This is the ultrasound study of a 45-year-old female, thyroid ultrasound, and what is seen is, first of all, this is the transfer section, and this is the tracheal air shadow. These are tracheal air shadow. This is the common carotid artery, and this is the internal jugular vein that on the left side. This is the left lobe of the liver. Left lobe of the thyroid. So the left lobe of the thyroid is normal in dimensions in transfer section. Now let's see the right lobe. This is the left one, and this is the right lobe. Now in the right lobe, you can see there is a focal mass, solid, with internal cystic areas. These are the cystic areas. This is the solid mass, and measures 3.5 into 3.5 centimeters with a halo around. This is the halo around it. This is the common carotid artery in transfer section. This is the common carotid artery in transfer section, and these are diffuse cystic areas within the solid mass, echogenic mass that we are studying. And this is the right lobe. Of thyroid. This is the left lobe of the thyroid. So, and this is the common carotid artery, internal jugular vein. So this is a transfer study of the thyroid gland. Showing an echogenic mass with internal cystic areas occupying almost all of the right lobe of the. You can see a rim of thyroid tissue around this mass. The dimension of the mass is again 3.2. Exact dimensions will be 3.2 by 3.0 centimeters, and this white band is representative of the right thyroid tissue that is preserved. This is the halo around. These are the tracheal air shadows. And this is the transfer section. So almost all of the thyroid right thyroid gland is being replaced by this mass with only a thin rim of this thin rim of thyroid tissue is preserved only. This is the transfer section. This is the mass, inhomogeneous mass, solid echogenic mass. This is the isthmus, this area. It's preserved, no issue in this region. And this is the longitudinal section of the right lobe of the thyroid, and in this you can see that the mass is on the medial side of the thyroid gland, whereas the lateral part of the thyroid gland is preserved. In transfer section we were unable to see this. This is a longitudinal section of the thyroid gland. Okay. With this being a cystic area within it, this is an ecogenic, well demarcated. See, you can see the outer surface, no posterior wall acoustic enhancement. These tiny cystic structures are representative of blood vessels. Maybe because I do not have the facility of a Doppler, so I cannot inform you about the vascularity of this mass. It is well demarcated, though no internal calcifications are seen in this, and the landmark, for the identification of the thyroid is the in longitudinal section is the common carotid artery. Now this is the common carotid artery in longitudinal section. So 22 by 19 millimeter of the thyroid gland, lateral thyroid gland, or 1/3 of the thyroid gland is preserved, and rest is occupied by a solid mass, and surrounded almost here it occupies the whole of the gland, expands the outer margin of the gland. This is the thyroid gland, and here it is being you can see there is a curve suggesting that it is the mass is the thyroid gland is being expanded by this pressure of this solid mass. So she will need a radioisotope study for this particular mass. So now these are the two lobes. This is the trachea layer. Once again, this is the common carotid artery in transverse section. This is the internal jugular vein, right, left lobe of the thyroid, and this is the mass in the medial margin of the left thyroid gland. This is the case of today. Thank you very much.